Nurse Deborah Donahue, clinical specialist at New England Sinai Hospital, describes just what PAT, the patient simulator, can do in training nurses and doctors in emergency care.
Well, Pat comes with wonderful features. First of all, very gentle individual. He has vocal sounds. He has heart sounds, lung sounds. The sounds even have abnormalities that would commonly be seen. He breathes. His chest rises and falls. He blows off carbon dioxide just like a normal individual does. He can develop a pneumothorax in which the lung collapses, and he has a rib cage in which physicians can then practice putting in chest tubes. He has pulses. His pulses go all the way from his neck to his feet. You can feel a pulse all the way down to his feet. He has his own blood pressure that you can hear with the stethoscope. He has advanced airway capabilities in which he develops emergency scenarios in which he cannot breathe. And now your only option is to give him a tracheostomy, a hole in the neck, and that's capable on the manikin. He also has his tongue swells. His whole airway swells in his throat when he has an allergic reaction like we saw today. And he also can do EKG monitoring. The man can be defibrillated with an electric defibrillator. He can be paced with a pacemaker. He has an arm that allows you to draw blood from. You can put an IV in the arm. Blood comes out of the arm. He also has a urinary bladder in which you can drain urine from his bladder. He has injection sites throughout various parts of his body in which you can give him an intermuscular injection. And he also comes with 25 x-rays.
Dr. Ann McNeil, Dean of the Allied Health Division at Massasoit Community College, tells why PAT, a manikin, is so good for teaching.
It's an important way to learn because what it does for our students that are there and for other medical professionals is that it makes their hearts pound. You know, they begin to sweat, they become quite anxious, they become very heightened in terms of what it is they need to do in this scene for this simulated patient. And that, in a way, draws upon a very different part of our brain. It's critical thinking, but in addition to critical thinking, it pulls us into making good clinical decisions. So it's a ripe and very fertile environment for very substantial and potential learning for our clinicians to be.
This is Sue Scheibel, staff reporter for the Patriot Ledger and Gatehouse Media New England. For more coverage, see today's newspaper or go to patriotledger.com.